So my background is I'm a mental health nurse and a CBT therapist. So I started my career in an acute hospital with young people and adults who were suffering with mental health illness. I saw, I guess, what young people and their families and adults went through at the very extreme end. And I think in comparison, Jigsaw's early intervention model really speaks to the really good work that you can do early on in a young person's life. I've seen, I guess, the impact of young people not getting early intervention or young adults. So I think that it's really an important place in Ireland in terms of early intervention. And the really important part of it is about helping that young person in the moment. So it could be that they're very anxious in school and they come and meet with a clinician, and the clinician works on the strengths that they have because they have lots of really good coping skills already. However, something may have happened in their life, such as a relationship breakup or an event that has, I suppose, destabilised them. So it's great to come and meet with a clinician and can be heard and listened to and certainly get some coping skills. And I suppose the purpose of it is to almost in a way potentially future-proof that they have now life skills to be able to cope with big strong emotions and situations perhaps where they are wanting to avoid in that moment. So it's really good to be able to come somewhere where your voice is heard and can be listened to, and you can work together as a team, I guess, really, and set goals, and by the end of it that you can go away and have better outcomes for yourself. So isn't it great to be able to learn how to cope and manage anxiety right now, so that when it crops up in years to come as well, you have some inherent skills and that you've been able to do that yourself, so there's a real sense of empowerment and achievement in that. If you go to your GP and there isn't anything else and you're not bad enough for CAMHS, then you're left on your own. Jigsaw means that you're not on your own with what you're coping with. You're not on your own with the mental distress that you're experiencing in the moment. When a young person comes to Jigsaw, generally they're coping with something in that moment that's really difficult for them, and it can be very overwhelming for a family and very upsetting for everybody. And they can quite often feel a bit very disempowered, and that the choices that they're usually making aren't working for them. And so they come to Jigsaw to get help and support with their mental health. And because it's a charity that relies on donations, so if you donate to Jigsaw, it means that you're helping a specific young person or another young person in the future that you either know now or will come in contact with.